Good morning to all of you. Trevor D, dealing and specializing in health insurance. I want to just mention today something that's probably would be useful for a whole sort of 10-minute talk, but on corporate schemes. The reason why, not just corporate schemes, but schemes for individuals as well, where the underwriting becomes very, very critical. So I had an email from someone last week who just referred to me and asked me to review their policy. Lots of cancer, he couldn't get obviously treatment with the NHS. His premiums have gone up an enormous amount, a really enormous amount, gone up from that to £18,000. And it was a company scheme. I've now been able to reduce that to £3,000. The reason for that was nothing that I'm necessarily skillful at myself, but the insurers compete with their declarations. If you don't do the hoops, you can find a company generally that will be able to cover one person or a group, but not with another company. So this particular company, I've suggested to go to AXA, because AXA have been brilliant at allowing corporate schemes where you only have to have, for example, on an underwriting called medical history disregarded, which means you don't make a declaration, and they cover every single issue you've had. Obviously, they don't cover chronic issues, but they take on back issues. For that, you only need 3 people to have medical history disregarded. So it's a most fantastic scheme, and it allows people who've had a history of health problems, especially on the group, to be able to have full cover for the previous issue. The other mention I'm very briefly on individual schemes is that, again, I've helped someone with diabetes to get cover for any flare-ups. It really is a matter of understanding the underwriting, and I know a lot of you are involved in these sorts of detail when you're writing policies or even with Wayne when he's making applications for clients. But it really is a matter of knowing the small print, and that's what we specialize in. So, ask me to review any of the policies, corporate or individual. Trevor G, patient health, occasionally with a bedside manner.